The first thing we need to do in a breast lift is we need to elevate the nipple to a higher position on the breast, and we need to get rid of excess skin. So we start by making an incision higher in the breast, which is going to be the new home for the nipple and areola, and we make these incisions lower down on the breast, and this is in between here is all the skin we're going to get rid of during the procedure. Once we've done that, we also need to reduce the size of the areola, because usually in a larger stretched, sagging breast, the areolas become quite stretched. We usually use a cookie cutter to do this to get a nice round shape. And then it's a matter of carefully removing the skin from the upper part of the breast once we've made these initial incisions. What we can see here in the breast is that with the yellow is representing the breast tissue and fat the breast is actually made of. And what I'm actually cutting here now, this is going to become the pedicle of our breast. It's going to be the thing that keeps our nipple and areola alive. And we make a cut here and here to free it up from the rest of the breast tissue. So once I've delineated the pedicle, I'm then going to gently elevate that, and then it's going to twist and rotate higher up into the breast. And all this breast tissue I'm bringing is going to help to auto-augment the breast and increase the volume at the top of the breast. And then we just gently keep rotating that up until it's in position. I'm just finishing pushing all of that breast tissue from the lower part of the breast into the upper pole of the breast to increase fullness, and I've put the nipple and areola into its new position. What's left to do is to keep this extra breast tissue we've got down the bottom, rotate it towards the center of the breast, and then I'm going to elevate the skin off the lateral pillars of the breast on each side. What we actually do at this stage of the operation is we lift up the skin, and then we actually just use our hands to gently push the remaining breast tissue together in the lower pole of the breast. And we use an internal bra stitching technique to strongly stitch in all of this breast tissue together, because that's what's going to hold the long-term shape of the breast and prevent ongoing sagging. So what's left to do is just the finishing stitches around the areola, close this vertical incision. So when we get down to the base of the breast here, sometimes there's some excess skin which we need to trim in a transverse direction, and that's what will give us our E-shape breast lift scar. So with a breast lift, you can either have the traditional lollipop scar, or sometimes if there's too much skin, we have to add in this T reduction down the bottom.